And now I will pass it over to our speaker, Tamara Powell with ODMH SAS.
Good morning, everyone. I am so happy to be here today and appreciate all of your attention and time. I am here today, as Rhiannon said, with the Department of Mental Health and Substance Abuse Services, and specifically with Systems of Care. Systems of Care, as you know, is a large partner with OFN, as well as several other members and partners who are on this phone call. And again, our focus is to really provide outreach to serve effectively families, youth, and children within our state. One of the efforts that we've really been working on internally to make sure that we are able to meet the needs of the individuals who are seeking services has to do with making sure that we are keeping our systems of care and network of care information up to date and most recent. I was hoping to share my screen. I'm sorry that I got in late on the slideshow deck. I wanted to, and I'm happy to share this afterwards, just give everyone a quick overview of how the network of care really works. How to search by provider, by zip code, really, again, just to make sure that we are getting people the services they need within their own communities. Outside of the network of care, Systems of Care has also been working to provide additional trainings, specifically to individuals and family and children. Of course, this is a great example of one of those collaborative efforts that have been put together. Today, I was really hoping to also speak with you all about the Children's Behavioral Health Conference, which will be held in April. April 11th through the 13th, actually, same place at the Embassy Suites in Norman, Oklahoma. But we are excited about that. And again, I am really reaching out to you all to ask you, who would you like to see present? What would you like to see covered? We do again have a very simple slide with some informative information, and I apologize again for that not being included this morning, but I will get that to you, where you would be able to make suggestions, recommendations, anything like that that you would like to see, whether it be for our families, for our general conference track, or for our youth. Again, we really want to move forward with trying to meet the needs and intentions of those who are reaching out again and seeking services through us. In regard to the conference this year, we will be looking at substance use and disorders. I do realize that last year we were a little light on that subject. So again, in looping back, we are trying to address those shortfalls where more content was requested to specifically offer again programming that our constituents are requesting. We are also going to be looking at a special populations track, specifically in regard to co-occurring disorders. We really also want to highlight a collaboration and partnership track. This would include individuals on this call, of course, and would not be limited to just those speakers that are coming in. But we really want to highlight our partnerships, not just our partnerships with other state agencies, but with entities like this, for opportunities like this, really reaching out to the community. So again, if you have ideas in mind, if you have content in mind, I would love to speak with anybody and everyone who has ideas. Again, I will make sure that my contact information and those quick cheater slides that you just click on to get to everywhere you need to go are provided. And I am happy to take any questions that you have. And I would also like to offer, as a Systems of Care community liaison if any of you have any needs in your community for presentation or resources related to ODMH, systems of care, or the ongoing statewide launch of the 988. I am happy to come to you to present, to meet with you, to speak, to provide you with resources, any way that I can help. I just wanted to throw that out there, that I am happy to come meet you where you are, and let's have a conversation.
Tamara, I was just going to let you know I am sharing your slides for you.
Thank you.
I'm just on the first one, so just so you know.
Okay, so can you see this?
Yes, we can.
Wonderful. Thank you so much. I really appreciate that. Sorry to loop back, but this is the simple slide that I had mentioned in regard to network of care. Again, these are really nice hyperlinks. So when you have the opportunity and time, if you just click on any of these, it's going to take you directly to the site mentioned. It would not hurt to familiarize yourself, even if you don't have information to update. But it's pretty neat. Again, here is my contact information here. Directly will reach out to me. And as I also mentioned, specifically with the 30th Annual Children's Behavioral Health Conference, we do have a simple slide here where you can, and please do, submit your speaker suggestions here. We are accepting them electronically this year just to make sure we don't miss anyone. We also have our nominations open for the awards that are given out on the last day of the conference. There are 2 Rising Star Award nominations that are currently open, as well as the Talent Advocacy Award and the CV Romano Award. If you have any questions about what these awards mean or what demographic they are focused towards, please, again, just simply click on these hyperlinks. And the first thing you're going to see is that criteria information. So if that award is not the award you were expecting, you're welcome to just back out and perhaps look at the other ones. Also, we are still seeking Talent Act submissions. As you know, for those of you that have been at the conference, we do like to really showcase our youth and give them literally a stage to perform on, to kick off our conference and set the tone for the day. And so again, we are still seeking those very talented young individuals. So everything is open, everything is accepting at this time. Again, if you have any questions about this, please let me know. I do want to very specifically thank Terry Kinder for working so closely with me on figuring out how to, again, best serve our youth and families for our conference next year. Again, I apologize for last year. There were several hiccups. It was my first year, and I'm looking forward to year 2 having specific improvements put in place. With that being said, this year, OFN will be again taking over the registration aspects for the conference in regard to youth and families. I very much appreciate that. We tried something a little bit different last year, and there were several hiccups. So again, I apologize, and I really appreciate Terry and Joni and Rhiannon having those really specific conversations with me so that we can again identify those gaps to make sure that we best serve our families and youth. So again, if you have any questions related to the conference that is in April, or the network of care, how it works, why does it work, what's going on, systems of care in general, training offerings, the 988, or just what's happening at the department, please do feel free to reach out to me at any time. And again, I'm happy to come speak with you. Thank you so much.
Thank you, Tamara, for sharing and telling about the Children's Conference. It is such an amazing thing that we do every year, and we're so excited to be a part of it. This year will be amazing. There will also be a youth side. So if you're interested in coming as a caregiver, I mean, your youth will be taken care of. They'll get to learn about mental health, work on coping skills, workshops, all kinds of things. So if childcare is an issue, don't worry about it. We got you covered. I would now like to pass the floor over to Terry Kinder, and she'll fill you more in on CBHN Network. Thank you.
Good morning, everybody. I just wanted to take a minute to just go over these slides really quick before we turn it over to Heath Hayes. And he will be talking about a great program that's already started enrolling in Oklahoma. So I'm just going to run through these really quick because we're already kind of running behind on time. So the Children's Behavioral Health Network is a collaboration of all of these great organizations that you see on your screen, which include Oklahoma Family Network, Parents Helping Parents, Evolution Foundation, NAMI Oklahoma, and the Department of Mental Health. So first, we're going to talk about the Parents Helping Parents. Parents Helping Parents, they provide education, resources, support groups for parents whose children, no matter what age, are struggling with a substance use disorder of any kind. And they are also one of the Oklahoma National Federations of Family chapters. So these are some of the things that Parents Helping Parents do. They assist with communities in organizing new partnerships. They have support partners all over the state. They do virtual support group meetings, and they're part of the Children's Behavioral Health Network. They provide workshops, education, outreach, consulting, training, and then they do a lot of social media outreach. And then they also have conferences and special events to raise awareness, including Days at the Capitol. And this is just a little bit about how they can help, just some of the things that they do. And then this is how you can get in contact with them. They also have a website right there in the middle of your screen. We can go ahead and send this out to everybody so that they have these links, as well as the email addresses that are included on these slides. So NAMI Oklahoma is Oklahoma's branch of the National Alliance of Mental Illness. This is a wonderful organization, and they provide support groups for peer-to-peer support for families that have loved ones with a mental health condition. They do Connections Recovery Support Group, which is a peer-to-peer support group for individuals living with mental health conditions. These are some of the resources that they provide on their website. And then these are a few more things that they do. Advocacy to ensure health reform and mental health. And then engage in legislative advocacy, kind of like going to the Capitol for those days at the Capitol to bring awareness. And then they educate about public policy. These are some of the free educational classes that NAMI provides. NAMI Basics is a wonderful 6 weeks and it sounds like a lot, but honestly, 6 weeks for families that have a loved one with mental health conditions under the age of 18. Sorry, that's actually one night a week. So don't let that intimidate you from signing up. And then the family to family is the same. And then the home front is specifically for families that have a loved one in the military. Evolution Foundation is another one of our partners, and Evolution Foundation is they focus on building community coalitions with technical assistance. They do coalition trainings, trauma trainings, and they've actually provided some of our speakers here today for some of our sessions. They do training, curriculum development, strategic planning, and they're just a really great partner in many different areas. And this is their website. And then Oklahoma Family Network. Oklahoma Family Network, some of the things that they do is we have staff all over Oklahoma, and our staff are parents themselves with lived experience. We provide podcast and training, quarterly newsletters. We do parent-to-parent matching. We are the parent-to-parent network for the state of Oklahoma. We provide support groups, and we also have SIB shops. Some of the trainings that we do are care notebook trainings, telling your story, supporting parent training, and then advocacy and leadership. We we help provide, because it's a joint effort, Joining Forces Partnership Conference, which is a statewide conference for parents and professionals, and it's planned by parents and professionals. Some of the Zoom sessions that we provide, provide are developing a family advisory committee, sitting on boards and committees. And then also we do awareness events, and we do lots of different types of events online that include family involvement. Like we've done the hope rings. We've also done calming water bottles. And these are some events that are coming up. Save the date for joining forces will be March 31st this year, 2023. And then we are going to have a virtual family summit for, sorry, this slide is really terrible, to provide feedback on child welfare. And that is going to be January 19th, 2023. And then NAMI will be having an annual conference on January 28th. And we will send these out so that you guys will have the links to all of these. And this is going to be, let's talk about mental illness. And then also Parents Helping Parents will be hosting a Renew You conference on February 22nd, 2022. So lots of great information, lots of great things coming up. And this was a very brief overview of what these organizations do. I know I kind of sped through it, but I don't want to take up any time from Heath because I know he has a lot of great things to talk about. So with that being said, I'm going to stop sharing my screen. If you guys need any more information on any of the agencies that we covered, please feel free to reach out to one of us. Email the Eventbrite back for where you got your Zoom links at, and we would be happy to provide that information to you. And we'll send out all of the publications and information after the conference, along with a survey. So with that being said, I'm going to go ahead and turn it over to Mr. Heath Hayes.
Thanks. I appreciate the opportunity to share and also learn. Allow me to join a little bit early so I can hear all the great things. Tamara, you speak to my heart when you talk about Network of Care. Thank you for being an advocate of that service directory and that platform. And also just to hear all the wonderful, amazing things that we got going on. It's great. It's a good time to be in mental health. For sure. And one of the things that I get to talk about right now is the 988 Mental Health Lifeline launch. And I am happy to say that we have really knocked it out of the park in terms of our awareness of it and the success and outcomes associated with its service. And so just to give you an idea and go through my typical spiel of it, 988 is a 3-digit number that was turned on in July nationally this year as an alternative to 911 when people are experiencing a mental health, emotional distress, or just needing some information, resources, and support as it relates to wellness and emotional well-being. And historically, 911 has been the de facto number. And so therefore, law enforcement gets involved most of the time because that's what's connected to 911 is emergency services. Specifically law enforcement and IMSA. And so what we as a nation wanted to do is really change the conversation around access to mental health services and provide a different way for people to connect with folks when they're experiencing emotional distress. And that's what 988 is designed to do. Every state has taken a different approach to how it's implemented and all of the services that are offered as a result of people interacting with 988. And fortunately, we live in a state where we have had tremendous advocates like yourselves and supporters like our governor and our legislative body, and then smart people in seats like our commissioner, Carrie Slatton Hodges, to be able to design something that is, as I've been referring to, as a Cadillac version of what 988 is able to provide, which is somebody to talk to, someplace to go if that's needed, and then also somebody to meet with you if that's what's also needed. So when you call 988, you get access to a licensed mental health professional, somebody who is trained either as a licensed individual or who is trained as a crisis call specialist. And oftentimes people who are answering the phone also have lived experience with mental health and addiction issues, which is something that, speaks to my heart. And so people answer that call 24 hours a day, 7 days a week, or text, because you can also text 988. And what you're able to provide is immediate intervention over the phone, whether that be just connecting with you or providing a little bit more intensive intervention so that you can get the help that you need. And there there's no limitation on how long people can stay on the phone with you. We want to connect with you and stay connected with you until we either resolve the issue or identify a local resource, a treatment provider, a support group, something to get you connected to the system, because that's what we know we need to do. Because when people get connected to our system, we know that the outcomes are really good. It's when people don't get connected to our system is when we see horrible things happen, like deaths by suicide and overdoses. And so we know that getting the number out is one of the biggest things that we can all do in educating the community on what 988 has to offer. So you get connected to this individual who's able to provide the intervention over the phone. And about 91% of the time, that's all that anybody needs. They just need somebody to listen to. They just need somebody to talk to them. And they just need that identification of a local treatment resource, which is why that network of care is so important, because that's where the 988 call center system is pulling from. That if your organization or your support system or your support group is not represented on that network of care, we might be missing the boat in terms of the comprehensiveness of what we are able to provide as a state. So just to kind of underscore the importance of that network of care. And so when we have that intervention over the phone, we're talking to somebody, we're able to connect them to their local resource or local treatment provider, their local support group. And that's not just done like, hey, call this number. If that person is willing, they can even make a warm handoff, call for them, schedule the appointment. Next year, this time next year, we'll have a little bit more technology integration so that where there's, say, a medical professional organization that has an electronic health record, we'll be able to even schedule people's appointments from that call center so that you have, when you get off the phone, a time, a date, and even maybe a person who you're going to meet with. So that you have the familiarity with not just, hey, the onus is on you to make that next step, but we've actually made that connection for you. And the wonderful thing about the call center too, is that that's not it. They also offer follow-up services. So they're going to call you and attempt to engage with you at least 5 times after you call in and are connected to a local resource to make sure that you made the appointment, to make sure that you have if you didn't make the appointment, what were your barriers when you what barriers did you experience in accessing that resource, which is really phenomenal, because we know that closing that loop and making sure that people have some type of support system in that regard is vital to the success of people connecting to our system of treatment and support services. So, but if that's not enough, we have another layer. And this next layer is really something that was born out of the children's system, which is the mobile crisis response teams. We are a leader in the nation in terms of our ability to lift up a program such as the Children's Mobile Response Crisis Teams. And so we leaned into that expertise and built one for the adults system too. And so when you call in, over the lifespan, right? This 988 number is for every single person, whether it's you yourself that is experiencing something, or your child, or your family member, your friend, your neighbor, whatever the case may be, you can call into 988. And if that is intervention that's able to be provided over the phone from the call center specialist isn't enough, they can dispatch a mobile crisis team. So mobile crisis team is a face-to-face intervention. So it's a licensed mental health professional and a peer recovery support specialist. A peer recovery support specialist, just as a reminder, as a person with, lived experience with mental health and addiction services that goes out in a pair to help de-escalate the situation, stabilize the individual, and provide an intervention face-to-face. Now, this is a statewide coverage thing. So we have mobile crisis teams all across the state. I think there's about 15 mobile crisis teams that we have partnerships, 15 organizations, not 15 teams, but 15 organizations that dispatch that are dispatch partners for the 988 call system. We have been, really ramping that up and have provided over 800 mobile crisis dispatched responses since July, which is phenomenal. We've received over 16,000 calls, over 3,000 texts. So people are aware of the service. They're using the service. It's producing wonderful outcomes in terms of stabilization and keep getting people connected to the treatment system and to the support system. But we have a long way to go. We want to see many more people calling 988, because the idea And kind of the design from our launch of the mental health lifeline is very intentional. Why we call it the mental health lifeline and not the suicide and crisis lifeline, because we want people to call before it's a suicidal attempt, before it's a crisis event, because we know that reaching out earlier in the process of uncertainty or emotional distress, we'll get connected to those resources and services that will prevent you from going into a crisis situation. And that's why we call it the mental health lifeline. And so calling at 2 o'clock in the morning because you're anxious, depressed, sad, lonely is an appropriate use of 988. Calling because you want to identify or you're curious about some behavior that your child's experiencing, we want you to call 988. We want you to use 988. When in doubt, call 988. If it's not an appropriate use, they'll tell you, and they'll connect you to that next kind of warm line, or 911, because 911 and 988 are able to transfer calls back and forth. Now, this is an undertaking that we had a very little insight into, but we have really leaned into our partnership with Solari, who's been operating a crisis call center in Arizona for 10 plus years. And so they have kind of fine-tuned the relationship with law enforcement and 911 dispatches, and have produced some really phenomenal protocols and processes and procedures to make those transfers happen. And so we are working with all 206. There's 206 911 dispatch centers in Oklahoma. If you didn't know, I didn't. That's a lot. We did not realize that was the way that they were structured, but that is. And so we are working with each one of those 911 dispatch systems so that we can integrate and transfer calls back and forth, and so that the person is receiving the appropriate response and appropriate co-response if that's what's needed. And so those mobile crisis teams dispatch across the state. But if that's not enough, we have another layer. The next layer is our urgent recovery centers and our crisis centers. So just to kind of give you an idea, a familiarity with the urgent recovery center, it's kind of like an emergency room for mental health. So it's a brick and mortar facility. People can walk in 24 hours a day, 7 days a week, and get some immediate response by a psychiatrist, a therapist, a nurse, a case manager, a peer, to kind of stabilize whatever's going on, whether that is missing medications or needing a place to sleep for the night, because you know there's been some things going on at home. You have the ability to enter into those urgent recovery centers voluntarily, 24 hours a day, 7 days a week. And the idea is that you stabilize there, and then you're again connected to community outpatient services or treatment services or support services localized. So we have been building and adding urgent recovery centers and crisis centers across the state. We've added 12 this year. We're going to add 12 more next year. So we're really beefing up our presence of urgent recovery centers and crisis centers across the state, and I've actually launched a couple of family and youth specific urgent recovery centers, which is really phenomenal. And we're really proud of expanding our footprint in that space too. And so we have all of these things in place, and we're really excited about the success of it so far. And getting the word out is the most important thing that we're trying to do right now. And so we have a way to do that. You can all be champions of this. You can visit our landing page, 988oklahoma.com. On there, you have resources, toolkits, downloadable materials, posters, coloring books, you name it. There is a plethora of things that you can immediately connect with, social media graphics that you can download and share, print and share. We also have a lot of videos, because at the essence, at the core of the essence of this campaign that we're using 988 as a launching point is an anti-stigma campaign. So we're really leaning into the lived experience of people from all walks of life who self-identify of having challenges with mental health, or having family members or friends, and being supportive people in the lives of those who are experiencing mental health and addiction challenges. Excuse me. And those videos are on our our landing page too, that you can download and share or show or add to if you have interest, or you have people who you think would be a really good person to help capture their story in a way that's meaningful and that's used as an advertisement tool. Is essentially what's happening. We would love and welcome that. We also have some public service announcement videos on there, some that are designed specifically for the general population, some that are designed for youth. We're adding to them. We have just actually launched and signed a deal with a local celebrity who's going to do a Super Bowl ad for us. That's really cool. Wow, it's just a lot of things going on. And so please connect with us on that webpage, follow us on all the social media channels, share as much as you can, because getting the word out, getting the people aware of 988 is the most crucial thing that we need to be doing right now, so that people have access to the treatment resources and support services that we have really been leading the nation in this space. So that's my spiel. I have time to answer questions or go into different aspects of what I've said or haven't said, if that is something that you all want to do.
Heath, this is Joni Bruce, and I have a question for you.
Yeah.
Are schools able to call 988 on behalf of a child or childcare centers, or if a grandparent has a child with them that is having difficulty?
So yeah, 988 is for everybody. The school can call it, the community can use it, but I'll tell you that we have one level better than that with school systems right now, because a House bill was passed this last year that requires every school to have a relationship with its local community behavioral health clinic. And what that relationship is to be responsive to those crisis situations. So in the instance where there's something going on at school, what our preferred method would be is for them to lean into their arrangement with that CCBHC, so that they can have that immediate connection to that mobile crisis team, so that it's there and available, and that they can, even through our prevention needs assessment and some of those MTSS kind of classroom management style things that we promote and that we try to embed across the state, we would really want those things to be activated before 988. But of course, getting the word out, having information available to the families, because there will be things that happen in the family that are not during school time. And so having that number and that connection to that resource is very important, and getting it ingrained in our everyday working language, just like 911 is, just like stop, drop, and roll. All of those things that we all are very familiar with was designed to be part of our culture. And so that's really what we want to do with this 988 stuff too.
Great, thank you.
Heath, do you have a message in the chat?
Oh. So the question is, can we get a list of where the urgent recovery centers are? That's a great question. On the network of care, we have a digital map and a connection of all of our urgent recovery centers and all of our crisis centers. I'm trying to see if this is on the campaign page. If it's not, I need to add it to it. Let's see. So I will put in the chat the link to our network of care that has a list of all of the urgent recovery centers in a digital format, so you can digitally connect with, share that information, link to a phone or a link to an email. So we try to make it as easy as we can for that to happen. There we go.
Another question is, can you please explain what is a CCBHC?
Yeah, a CCBHC is a comprehensive community behavioral health clinic. And what this is a new way of doing business, if you will, for our mental health treatment providers. And so they are able to beef up their staffing ratios. They're able to make sure that they more intentionally integrate different recovery support services like housing and employment services, and make sure that addiction is a treatment services that's available within the structure of the organization versus having to refer people out for various things, and then make sure that they're connected to the individual such that they're not going into the hospital all the time, and really make sure that the community service is provided to the extent that if it needs to be an intensive service, it needs to be wraparound services like the children's services are very familiar with doing. that is available for the individual. So it's a different way of doing business with those partners that we've had for a really long time. And we're the very first state in the nation to have complete statewide coverages for CCBHCs. And so you see the expansion of treatment services and the expansion of the workforce. It's because of our new model of the CCBHC. So another question is, are all the calls answered locally in Oklahoma? Yes, that was a very important thing to us. And so when I mentioned that we partnered with an organization called Solari out of Arizona, our contractual contingency was that they establish a presence in Oklahoma and hire only Oklahomans to answer Oklahoma calls, because we believe that Oklahoma knows Oklahoma better. We know our nuances, our resources. We can speak the language of Oklahomans more appropriately than Arizona. I will tell you, one of the cultural differences that was very apparent to Solari from Arizona was that we like to talk versus what Arizona is experiencing in terms of their call length of call even. So that was an adjustment for them. They didn't know that we had lots of things to say, or that we were slower in our dialect. And you would think Arizona is not that far away. Why is it so different? But you think about Oklahoma in and of itself, there's a lot of difference within Oklahoma itself. And so, yes, all the calls are answered by Oklahomans. And even our backup center is an Oklahoma backup center. So if for whatever reason, the call is missed, and 99% of the time it's answered by Solari. There are instances maybe when the phone lines are so busy that it rolls to the backup call center. That's very rarely happened in the 6 months that we've had operationalized, but it's also answered by an Oklahoma nonprofit organization. So all the calls are answered by Oklahomans, yes. So the question is, if we live in a rural area and the call is answered in the OKC area, are callers routed back to a local rural crisis center? So the answer to your question is yes, everything is localized. And so based on your location, you might be talking to somebody in the Oklahoma City area, but when you're referred to a treatment resource or you are connected to a crisis center, you're connected to the closest treatment resource that's available that meets your needs. Any other questions that you might have?
You might have stated this, but can you text the 988 number as well?
You can. Yeah, just 988. Text it.
Thank you.
You're welcome. Now, we've received about 3,000 text messages so far.
Is there anywhere anybody can provide feedback for 988 experiences that they've had?
It's a good question. I don't know if we have that specifically. You can always send me information. I'm like the 988 person for sure. But that's an interesting question. We could definitely, I know that there most likely is one for like the national 988 kind of feedback. But if you were wanting to provide information specifically to us and either like I want to give a testimony or things like that, I don't know if we have that opportunity available right now that's specifically outlined, but we can definitely add that to our campaign landing page. It's a good idea.
The question in the chat said, you said that we are leading state for 988. How does our response numbers compare with other states?
That's a really good question. So when I say that we're leading the nation, so there's certain metrics that are evaluated from the call center response. And let me show you, we also have this as a public facing thing. So I'm going to share my screen. I'm going to share this with you all. I'm going to share my screen so we can go through it. You all can see my screen, correct? Okay. So this is a public facing dashboard, which gives some high level statistics regarding our call center operations. It's a rolling 30-day average. So in the last 30 days, we've received on average 2,770 calls. Our answer rate is 99.1%. So that means 99.1% of the calls were answered within 15 seconds, which this is a huge, huge indicator of success. So most other states are not in the 90s. And I'll tell you, when we were having the National Suicide Prevention Lifeline, that this was a metric that was also evaluated for the success of the National Suicide Prevention Lifeline. This was typically in the 70s for Oklahoma. So we have almost 100% answer rate of that metric of getting, I'm sorry, 90 seconds. It says, see, this keeps me in check. 90 seconds. So this is answering the call within 90 seconds. 99% of the time that call is answered within the first 90 seconds. So it goes through the call tree, right? So press 1 if you're a veteran, and then it routes to Oklahoma's, so that the clock starts ticking as soon as you dial 988. And so 99% of the time that's coming straight to Oklahoma. And so every others, this is the metric that's evaluated the most stringently. And there are 3 other states that have a higher than 99.1% answer rate. And so we're the 4th in the nation from being able to answer that phone that quickly. Average speed of answer is usually 11 seconds. So even though we have 99% calls answered within 90 seconds, it's on average, we're answering in 11 seconds. So that's pretty phenomenal, that speed. And then the stabilization rate, again, is another one. So 91% of the people who call is the telephonic support is all that they needed. They were able to resolve. The professional answering the phone was skilled enough to be able to connect that person or resolve that person's situation and that moment to be able to not have to dispatch additional services. So that's another really important metric, 91% of the time. On the research that we put into this before launch, on average was about 80% of the calls would be stabilized, and that was the goal. So you can see that we're exceeding that goal substantially here. So these things are really what put us in the one of the top tiered states of being able to launch this. And so you can also take a deeper dive into like, what are the top 5 referral sources, self being 66% of the time, which is what we want to see. We want people to be reaching out and calling and feeling comfortable to connect with us. Here's an average of calls volume by month and breakdown of that. People often also ask, why are people calling? So here's an idea of what are the presenting issues that people are calling about. So self-harm and suicidal thoughts, again, being the primary reason people are calling, which is a good thing that we want this group to be the most calling. But maybe it's coordination of care, maybe it's understanding what treatment services are available or access to specialties, depression, anxiety. And then you can see substance use has a percentage here, 2% of the call volume. And the last 30 days has been about a substance use specific issue, or whether it's housing, domestic violence. So it gives you a little bit of a breakdown. And then here are the dispatched by month volume of our mobile crisis teams. So thanks for those questions. I forgot to show you that, but that again, this is a public facing dashboards that's on that website that I shared in the chat so that you all have access to live information about our success and our outcomes associated with it. When will we be able to compare suicide rates before and after the implementation of 988? That's a really good question too. Usually the suicide rate statistics are a couple of years behind. And so we wouldn't know specifically the relationship of pre-988, post-988 for a couple of years.
Do you think that we've that everyone in Oklahoma knows about 988? And if not, what areas do we need to focus on advertising 988?
I feel like I've been talking about 988 so long, but in my bubble, right, of awareness. But No, I don't think that everybody knows about 988. I do think a lot more people know about 988 today than they did 6 months ago or a year ago. But I would say underserved populations and populations of higher risk. So men is our most, men aged 35 to 65 are our highest demographic of those who die by suicide. And so you'll see some specific targeted messages that come out through paid media. And so that's what we spend a lot of our time on is figuring out how to reach those hard to reach or hard to take action populations. So that population, we have a higher prevalence rate of native tribal members who are dying by suicide, the LGBTQ population, and then Latinx and African-American population. So getting the word out and strategically to engage those communities is something that we're working very hard to do. And then using the power of social media and the power of understanding people's demographics based on their cookies and their breadcrumbs and all of their web search behavior. It's kind of scary, but it's also being used for good right now. So that's a good thing. To better target people who are at higher risk. And so if you're not seeing 988 advertisements right now, it's probably because you don't fall into a demographic. But if you are, it's primarily because we've strategized the way that you would receive that message by prioritizing populations that are typically at higher risk. Is there anything specific that you have done to focus in rural areas that don't have billboards available? Yes, that's a great question. And so when we talk about trying to engage people with 988, we look at digital behavior, and where there is not a lot of digital behavior, we do other strategies such as gas pump nozzles. So in rural Oklahoma, we have 988 plastered over the gas nozzle, which is a really cool thing. I didn't know you could do, but you can. We have pizza box topper stickers. So those companies that are partnering with us that deliver pizzas, because pizza is kind of a universal food for most people, and so we've leaned into those relationships. We have bar coasters, so we're in the process right now of getting coasters out to bars and to restaurants that have the 988 information on it. And then we have coffee sleeve holders that I just ordered 8,000 yesterday, so we're going to be disseminating those. And so, yeah, we've got some different methods and some different approaches to getting people aware of the number. And those are some of the examples. But for those billboards that we do have in rural areas, we have a billboard specifically targeted toward rural Oklahoma, and it says, "Even cowboys cry." And it's a really beautiful imagery. I'm so in love with all of the artwork that we've been able to do with this campaign, and the messaging that really just cuts straight to the point, simple and easy to understand. We've gotten a lot of great feedback from folks that have seen that specific billboard.
Well, thank you so much for all of this information and answering all of our questions. We are so happy to have you here. Does anyone else have any other questions before we let Heath get back to his daily work?
Sorry, I was on mute still. I had a question really quick.
Yeah.
One of the things that I've noticed that Oklahoma does a great job of when I don't even remember the name. It's they do the trash cleanup poster contest, and then they make a calendar out of it. Has the department considered doing something targeted towards youth, like some type of poster contest or something that would be, because that in itself would spread awareness, them learning about what it is just to win something, because I know a lot of times in rural areas, 4-H departments and FFA and, small schools try to get involved in those poster contests, because I always see the Don't Trash Oklahoma, or the posters about, keeping Oklahoma clean and, you
Mhm.
know, they make the poster contest out of them. Also, they could get in a calendar. And I was just wondering if you guys had done anything to kind of target youth to get them involved and help with, I mean, because advertising and on the other side of it to help with the art side of it too.
Thank you, Terry. That's a great question. And the answer is yes. And I could definitely use the help of this group to get this launched more widespread. And so on our landing page, we have coloring sheets. And those coloring sheets have different imagery about, 988 and underscores the importance and when you reach out and use this system. We have coloring books that we have developed too, that we are turning into a calendar. And so the idea is that people will engage with these coloring sheets and these coloring books, and then share their information. And there's a way to share on the coloring pages to social media so that we can then create a calendar based on that. And so we're still in the early stages of what that kind of larger campaign would look like specifically around those coloring books and coloring sheets. But getting those coloring books and the awareness of the coloring sheets that can be printed and downloaded from the website even is something that we need help with doing. And so any thoughts or ideas on how to do that or get the information out or the coloring books in the hands of folks, please let me know.
Well, if anybody doesn't have any other questions, we can just go ahead and jump off a little early. And we have more sessions starting in 30 minutes. So thank you so much, Heath, for your time. Thank you, Tamara, for your time. And we greatly appreciate you guys joining us today and giving us more information on the CBHN conference and on the 988.
Thank you.
Thank
Bye-bye.
you. Y'all have a great day.